Hi, my name is Dr. Richard Bauer. I'm an oral surgeon at the University of Pittsburgh, and I will be discussing the clinical vignette that we just witnessed. I find it very important to set expectations with our patients, specifically in relation to the vignette you just watched. I established a preoperative and postoperative plan for discomfort and laid out a multimodal pain management strategy for the patient. This included medications as well as external application of ice. It is important when we discuss with our patients postoperative scenarios that we specifically talk about pain management and have multiple options for those patients, specifically options that do not require narcotic or opioid usage. It is very reasonable that our patients will need narcotic pain management. And based on new regulations, we're unable to call these prescriptions in. So it is important and very prudent of you to provide an adequate amount of opioid pain management and set expectations early on with the patient, even before the surgical management if possible. Providing opioids from a pain management expectation is tricky. And typically, we like to prescribe smaller amounts initially based on previous experiences. I did discuss with the patients that this limited prescription of 10 tablets is important and that only should postoperative complications arise would we need to prescribe more opioids, and that we would deal with that on a case-by-case situation. However, the prescription that I provided is typically enough to manage the postoperative expectations. Overprescription of opioids can lead to increased quantities of opioids in the household and lead to misuse or abuse. During the initial patient interview, I set up the expectations with the patient, gathered medical information as it regards to social and surgical history. And these components of the patient's history are very important. They can give you insight on the patient's prior exposure to opioids or illicit drug use.